Hi everyone, this is Dr. Sargam, and since a lot of you requested me to upload a video on instruments and the cataract surgeries, so we'll be discussing today about the important instruments for your FMGE, for your NEETPG, or even your third prof exams, and the steps of cataract surgery and how they are different in different types of surgeries. So starting with this first instrument, this is your universal wire speculum. So why is it called universal? Because it can be used in both right eye and left eye. This has got two limbs and here they are attached via a spring mechanism. If we look at the function, so it is used to expose the eyeball during the intraocular surgeries. So I have a different type of wire speculum with me in my instrument box. So again, this has got two limbs and here they are attached via this screw mechanism. This is your spring mechanism. This is your screw mechanism. So how do we apply it? We apply it like this. This will go in the upper lid. This will go in the lower lid. Here we will tighten the screw, and by tightening both the lids will separate and they will expose the eyeball. This image is of your limbs, forceps or the corneoscleral forceps. Now let's take a bigger, let's look at a bigger and a closer view. So if you have got an instrument like this with one bend, two bend and toothed ends and one bend, two bend, then you call it as limbs forceps. So if you see here also, you have got one bend like this and the other bend like this. Okay, one is slightly oblique and the other one is slightly horizontal, and it has got teeth in the anterior part. So where is it used? It is used to catch the cornea or the sclera or even your conjunctiva and Tenon's capsule during the surgery. Next, this is what you call as Eruga's forceps. Now, how will you tell this is Eruga's forceps? The anterior part, or you can say the terminal part of the forceps will have two circles, both facing each other on the inside of the forceps. So what is it used for? It is used in ICCE to hold the anterior capsule at 6 o'clock position. Next, so if you get an image like this in which you see you have small and stout forceps with flat and blunt ends, then you will call it as epilation forceps. Unfortunately, I don't have that with me. So its indication is it is used to remove the trichiatic eyelashes. The next one we have got two very similar structures. One is your lens hook and the other one is your muscle or the strabismus hook. Now, how will you differentiate between the two? So, if the end of the instrument has got a guarding knob, so if the end has a guarding knob, then it is suggestive of a muscle hook. Now, what is the purpose of this guarding knob? This prevents the muscle slippage during the squint surgery. The other one is your lens hook. You will see there is no guarding knob at the end. So what is it used for? It is used to provide counter pressure to the eyeball at 6 o'clock position. Next, this is your Desmere's lid retractor. So what is it used for? As the name suggests, lid retractor. So it is used to retract the eyelids, or you can say open up the eyelids in conditions such as blepharospasm and in cases of trauma. Next, this is your, if you can see, this anterior end resembles like a cat's paw. So this is a cat's paw retractor. This is your Mueller's self-retaining retractor. So both of these, they are used in lacrimal surgeries. By lacrimal surgeries, I mean DCR. So cat paws retractor, what will it do? It will retract the skin during DCR. And your Mueller's self-retaining retractor will retract the lacrimal sac during the DCR. Then this is your, if you can see, this is a needle holder. And yes, it has a name. It is Castroviejo's needle holder. So basically, it is used to hold the sutures when you have to apply it either on the cornea or the sclera. And the other one, these are your Eruga's needle holder. See, Eruga's needle holder was used in earlier times. Now it is not used. But what we use these days is a Castroviejo one. So this is your Castroviejo needle holder. Then again by the name of Castroviejo, this is measures the distance. Basically, it measures the particular distance from the limbus. Now, what does it mean? Suppose you have to apply intravitreal injections. So, they are applied at a specific distance from the limbus. Say 3 mm in patients of aphakia, 3.5 mm in patients of pseudophakia, and at 4 mm in patients who are normally phakic. So this is the distance of applying the intravitreal injection from the limbus, right? So how will you calculate this distance? Since it is, very close to each other, if you apply it at a wrong distance, you will damage the normal structures. So this measurement is done via this Castro-Vizio calipers, and this distance is in millimeters. The next is this diamond shaped blade is referred to as keratome. Now, what is the use of keratome? So it is used in cataract surgeries to make a valvular entry into the anterior chamber. So basically, when we have to enter the anterior chamber from the cornea, we have to make a valvular entry. Valvular means first like this, then like this, then like this. So this is how we enter from the cornea to the anterior chamber. So this is a 3-plane, or what you call as valvular entry. Why do we have to do it? We have to do it to prevent the chances of post-operative infections. Because if you just make an entry directly, what will happen? There will be chance of prolapse of iris from the wound. But when you make a valvular entry, then the chances of iris prolapse from the wound, they decrease. So the chances of post-op infection also decreases. If you look here, this has a structure like this. Here you have got sharp cutting edges. Here the edge is relatively blunt and these edges are sharp. So what does it do? This is a crescent and this is used to make corneoscleral tunnel in ICCE and ECCE. ICCE is intracapsular cataract extraction and ECCE is extracapsular cataract extraction. Then if we look here, this is your 15-degree side port. This has got just one cutting edge. This edge is not cutting. So when you have one cutting edge, you will call it 15-degree side port. And if you have both the edges are cutting, then what do you call it as? You call it as either MVR or the V-lance blade. What are these two used for? Both of these are used to make the side port entry in the cataract surgery. The next one, if you look here, this is a needle. So it has got one bend here and the other bend like this. So one bend here at 90 degree, other bend here at 90 degree. So almost 290-degree bends. What is this called as? This is called as cystitome. What is it used for? It is used to make anterior capsulorhexis in cataract surgery. Now what does that mean? We know this is our anterior capsule, this is your posterior capsule, and here we have got the cataractus lens. So how will we remove it? What we do is, say you are looking at anterior capsule from the front. So what we do is we take a cystitome, we make a flap like this and we move it like this and we remove this part of the anterior capsule. So what have you done? This is what you call as anterior Capsulorhexis. And if we look transversely or if we look laterally, what is left behind? Then just the peripheral part of the anterior capsule is left and whole of the posterior capsule is left. So what is this thing called as? This thing is called as the bag of the lens. And where do we implant intraocular lens? We implant the intraocular lens inside this bag. Okay, now if you look here, this has just got one bend and that too towards the end. यहाँ पे the first bend needle की starting में ही हो गया. But firstly, this is not a needle. Then it has some number written over here, 1818. So this is a hydrodissection cannula. And it comes in various sizes and depending on the size वो gauge mention होता है. Now what is hydrodissection? We know we have nucleus here. Nucleus के side में we have got epinucleus and then we have got the cortex. So hydrodissection means you are dissecting it. What are you doing via hydrodissection? You are making a fluid wave. What happens? You will inject the fluid. This is your hydrodissection cannula. So what will happen? You will place a syringe here and you will inject the fluid between the anterior capsule and lens. So now the fluid will go behind the lens and it will separate whole of the lens from the posterior capsule. So this is the role of hydrodissection cannula. Okay, sorry, I have got another via speculum also. So this is the one that I have shown you. This is via the spring mechanism. The next, this is your, if you can see, this is a scissor. So this is your corneoscleral scissor. If you look at the angle here, this is a bit curved. But here, it is at almost, you can say, 90-degree angle. What is this scissor called as? This is referred to as your Vanna's scissor. What is it used to cut? This cuts your cornea, this cuts your conjunctiva, this cuts your Tenon's capsule. What does Vanna's scissor do? This is used to cut the anterior capsule. So this scissor is used outside of the eye. This scissor is used inside of the eye. This is the difference. If you look here, this is nothing but your enucleation scissor. How will you identify it? Firstly, this is a relatively larger instrument. Then it has got two curved ends like this. Okay, so it has got two curved ends. What is it used to do? It is used to cut the optic nerve. Basically cut a part of the optic nerve during the enucleation surgery. This is nothing but your lid clamp, also known as entropion clamp. Sorry, I forgot to show you the scissor. So this is your corneoscleral scissor. If you can see, it is a bit curved. But this is your 1S scissor. If you see, it has got an angle. So this is the difference. If you see, this is corneoscleral and this is your 1S scissor. Then this is your lid clamp or the entropion clamp. So what is it used to do? This is basically used to clamp the lid during your entropion surgery or your lid surgery. Then during, you can ignore it. This is your chalazion clamp and this is your chalazion scoop. This is used in your chalazion surgeries. Then this is your wire vectis. So this can be either long like this or short and relatively broad like this. So I also have a wire vectis with me. So this is your wire vectis. If you see here, there's a hole here. So what will you do? You will take it inside of the eye. You will let the nucleus rest here and you will take it out like this. So it is used to express the nucleus during cataract surgery. Then this is your irrigation and aspiration cannula. Or you can call it as Simcoe or the two-way cannula. So if you look at this is your Simcoe or the two-way or the irrigation aspiration cannula. So basically you apply an IV tube here. So what will it do? You will irrigate the eye from this. So where is it used? It is used to pull the cortical fibers left after the expression of the nucleus and epinucleus. So you will irrigate the eyeball via this. And how will you pull it? You will pull it through this end. How? You will apply a 5 ml syringe here and you will create suction in the syringe. So what will happen? Wherever you keep it, the cortical matter from those sides, it will get cleared up. Then this is your bimanual irrigation and aspiration cannula. Bimanual means we have got two different instruments. So this is used in Phacoemulsification. The next, if you look here, this is your iris repositor. Now how to identify it? So you will have, I have it with me. Yeah, this is your iris repositor. So it will have a central, it will have a central body and it will have two limbs. So one will be a bit curved like this and the other one will have an angle. So this is your curved limb and this one has got relatively an angle. So this is your iris repositor. When is it used? So suppose this is the iris that is coming out from your main wound or the main incision site. So you will put it on the iris like this and you will reposit it back inside the eyeball. This is your, if you can see here, there are no tooths inside of it is very smooth. So what do you call this instrument as? This is your McPherson's forceps. I have that also. So this is your McPherson forceps. Inside is very smooth and the ends, they are not pointed and they don't have any tooths. So what is it used for? It is used for holding and inserting the intraocular lens during the cataract surgery. See, in phacoemulsification we have a cartridge. So हम foldable lens करते हैं उससे. We have got a cartridge or a pen like this. So suppose this is the wound. So we press the cartridge and automatically the lens goes inside the eye. But where we have a big tunnel such as ECCE, what we have to do? We have to manually insert the IOL. So what will we do? We will hold the intraocular lens from here and we will manually insert it inside the eye. So this is what McPherson forceps is used for. Then we have got two very similar instruments. If you look at the ends, so this is comparatively more sharp and this is less sharp. So the less sharp one is referred to as your IOL dialer and the more sharp one is referred to as your chopper. Now, what is the role of these two? If we see, so when you put the intraocular lens inside the eye, so it is not necessary that it will go in a that it will go inside very properly. So if once it is inside the eye, it might be like this up down. So what do you have to do? You have to dial it. So this is your, see if okay. So this is your dialer and this is your chopper. Chopper is sharp. Dialer is less sharp. So this is used to dial the lens after you have put it inside the eye. You do movements like this. Then what is chopper used for? Chopper is used whenever, suppose this is my phacoemulsification probe. So what happens in phacoemulsification? We are using the machine to break the nucleus. So how will we do? We have the nucleus. Suppose this is the nucleus. Okay. So we are putting it between the phaco probe and the chopper. And we are applying the force from both the ends. And we are trying to break the nucleus. So this is the role of chopper. Then this is your, if you can see here, this looks like a punch. So this is your Kelly's punch. Where is it used for? This is used to make sclerotomy, means holes in the sclera during the glaucoma surgeries. What are the glaucoma surgeries? Basically during your trabeculectomy. This is your lid spatula. What is it used for? This is used for lid massage. When is lid massage required? In patients of meibomian gland disease. Then this is your, if you can see here, this is your punctum dilator and these are your Bowman's probes. So what is with respect to this numbering? So we have got Bowman's probes of different numbers and depending on the age of the child they are used. So where do we use Bowman probes? These are used in probing in cases of congenital nasolacrimal duct obstruction. Then this is your lacrimal bone punch. So lacrimal bone punch is like this. It is vertical, but your Kelly's bone punch is like this. You have to hold it horizontally. So this is the difference. Then it is used to make a hole in the lacrimal bone during your DCR surgery. What is this? This is your lacrimal sac, curate and dissector. Again, this is used to separate the lacrimal sac from the lacrimal bone. So this part is your dissector and this part is your curate. If we look here, this is a spoon, right? This looks like a spoon. What do we call it as? This is your enucleation spoon or your optic nerve guide. Say this is your optic nerve. So what will we do? We insert it like this. It has got a mouth. So it will be inserted here and here we will cut the optic nerve or anterior to it. So we call it as optic nerve guide. Then this is your evisceration spatula. This is used in your evisceration surgery. Now, moving on to the cataract surgeries, we have got different types of capsulorhexis. This you can get as image-based question. Capsulorhexis is of 3 types. The most common is your continuous curvilinear capsulorhexis. So, in continuous curvilinear capsulorhexis, we make a flap like this and we make an absolutely round capsulorhexis. The other one is your can opener type. In can opener, instead of round, our rhexis has got multiple tags. And the third one is your envelope type. So in envelope type, your rhexis is made like this. You make a horizontal nick, you elevate it and you make a envelope like this. So these are the types of capsulorhexis. If you are given in a question a rhexis like this, now you can tell this is can opener, this is envelope and this is your continuous curvilinear capsulorhexis. Now moving on to the steps of ICCE. What we do in ICCE, basically we are taking out whole of the nucleus with the capsular bag. So what are we doing here? We are taking out anterior capsule, posterior capsule and the cataract. Whole mass is taken out in toto. The only indication for this at present is your subluxated or the dislocated lens. Now if we look here, we have applied the superior rectus suture to hold the eyeball. Okay. Then we have made a cut here in the conjunctiva and the tenons, and then we make an incision here on the limbus. We cut the incision, enlarge it. Then we take whole of the anterior capsule, posterior capsule and the cataract out of it. And then what this is here, this type of intraocular lens is what you called as anterior chamber intraocular lens. And then we place in anterior chamber intraocular lens. Why? because in the posterior chamber we have no support to keep the IOL. The other surgery is your small incision cataract surgery, which is a type of ECCE. So in this you make a capsular bag. Again, here you have cut the conjunctiva, you have made an incision on the sclera. So this is your scleral incision, which was done using the crescent. Then what will happen? This here you are entering the anterior chamber via your keratome. Then you are making a side port here with either your MVR or 15 degree. This step is you are doing the Capsulorhexis. Then you are doing the hydrodissection. Then using the dialer you are dialing the lens, or you can say you are dialing the nucleus. Why are you dialing the nucleus? To lift it from the capsular bag into the anterior chamber. So here the nucleus came out in the anterior chamber, and using the wire vectors you have removed it. Now you are doing irrigation and aspiration and removing the cortical matter. Then you are placing an intraocular lens inside of the bag. So once you have placed it using the McPherson forceps, you are dialing the lens. This is your dialer, and then you close the wound. So this was SICS. Then is phacoemulsification. Phacoemulsification, we make incision. So in phacoemulsification we have got clear corneal incision. That means directly on the cornea we are making incision, and we are not involving the sclera. Okay, then you are making the capsulorhexis, you are doing hydrodissection to separate the nucleus from the capsules. Then using this phacoprobe, this is your phacoprobe. So basically we have got a phacoemulsification machine. So the machine is kept, from there we have got tubing, and then we have a probe like this. So here the incision size is 2.8 mm, which is standard. But these days we have got better surgeries in which the incision size is reduced to even 2.2 mm. Then you have, after removing the nucleus, you are removing the cortical matter via the irrigation and aspiration. Then capsular polishing is not done routinely. Then you are implanting the lens. See, this is the cartridge. Okay, so lens is folded inside. So when you press the cartridge, the lens automatically goes inside the bag and it automatically opens up. Okay, and then what you do is you close the wound. So this was about phacoemulsification. Now we know in phacoemulsification the wound size is very small. It is just 2.8 mm. Here in SICS, using a crescent, you have made the sclerocorneal tunnel, and the tunnel size is at least 7 to 8 mm. So this is bigger.